So we come to the next section. The next section talks about bone tumors. Orthopedic oncology. Orthopedic oncology will always give you image-based case scenarios or spot diagnosis. Whenever we want to diagnose a bone tumor, remember there are two things which are important. One is age of the patient. Second is part of the bone affected. When we look at the part, because that's more significant, we have done this. Metaphysis happens to be the most common area where infections and tumors occur. And if you have to choose one tumor in the metaphysis, the king is osteosarcoma. Whereas in diaphysis, we will love to remember Ewing's sarcoma. We must also remember osteoid osteoma. We must also remember adamantinoma. So these are three tumors that one should remember in the diaphysis. When we come to epiphysis, in epiphysis, remember this golden point. It's chondroblastoma, which is the number one tumor, followed by giant cell tumor. Many people, they remember opposite. Remember it's chondroblastoma more than the giant cell tumor. Also, if they say epiphysis with calcification, in that scenario, remember your answer will be absolutely chondroblastoma. This is about the part of the bone. In the body, there are some areas that one should remember, like upper end of humerus, you must remember unicameral bone cyst, also called as simple bone cyst, single cavity cyst, followed by chondroblastoma. But we know that chondroblastoma calcified. Similarly, remember for the aneurysmal bone cyst, it's more common in lower limbs. Tibia is very common. And I want you to remember the third bone site, lower end femur. Friends, this is the commonest area where osteomyelitis occur. Two tumors which are very common in this area, osteosarcoma and the giant cell tumor. They are most commonly seen at the lower end of femur. So this is what we have done. If they talk about epiphysis, chondroblastoma more than GCT. Epiphysis plus calcification, chondroblastoma. Upper end humerus, unicameral bone cyst more than chondroblastoma. Metaphysis, osteosarcoma. Diaphysis, osteoid osteoma, adamantinoma, Ewing's sarcoma. Epithelial bone tumors. Mind you, it's not epiphysis, epithelial. You have tibia, which will have adamantinoma. You will have in mandible the ameloblastoma. Before 1985, ameloblastoma and adamantinoma, these were interchangeable words. But hence, it has been said that the epithelial tumor of tibia is adamantinoma and the epithelial tumor of mandible is ameloblastoma. So ameloblastoma most commonly involves the mandible, but mandible or jaw The most common tumor is squamous cell carcinoma, SCC. This is a very, very important page. The man who classified bone tumors was King. Remember this name. Also remember in the tumors, part affected is more important than the age. But if they talk about the age, first decade of life, Ewing sarcoma. Second decade, osteosarcoma. But there's a catch. If there are 10 tumors in the first decade, out of them 9 may be Ewings. Whereas if there are thousands of tumors, majority of them in the second decade, 800 to 900 will be osteosarcoma. But if we just look at Ewings, although Ewings is the most common tumor of first decade, but you will see more number of cases of Ewings in the second decade. So Ewing sarcoma, second decade more than the first. After skeletal maturity, they say this age group is 20 to 40, mean age 30. We talk about giant cell tumor. And after 40, this is the most common age for the tumors. You have metastasis followed by multiple myeloma. Multiple myeloma happens to be the number one primary bone tumor. Metastasis is the number one bone tumor. Metastasis to the bone usually come from the breast, prostate, followed by the lungs. In children, the metastases are rare because they occur after 40. But if they occur, they will be from neuroblastomas. This is an example where adamantinoma involves the tibia. Remember this image, very important. Polyostotic lesions means involving multiple bones. So when we talk about polyostotic lesions or the tumors involving the multiple bones, we must remember first names. Number 1, exostosis. Also called as osteochondromas. Number 2, fibrous dysplasia. And you know what? These two are developmental malformations. They are growth abnormalities. Number 3, enchondromas. Number 4, giant cell tumor. Number 5, Ewing's sarcoma. These are the 5 names that should be imprinted in your brain when they talk about multiple lesions or polyostotic lesions. Radio-resistant bone tumors. Remember the name osteosarcoma. 90% of questions on this point, this will be the answer. Even the cartilaginous tumors are radio-resistant. In fact, the cartilaginous tumors are chemo-resistant also. So osteosarcoma followed by chondrosarcoma. One more name which you must remember amongst the options in orthopedics is malignant fibrous histiocytoma. This is also radio-resistant bone tumor. Whenever I talk about treatment of bone tumors, tumors of the bone are in orthopedics, and ortho is a surgical branch. So usually you operate it. There are some areas where the lesion is simple. There is a cavity with the content inside. You open it and you clean it. This is called as curettage. simple curettage, open and cleaning, also called as dry mopping. In Hindi, it's called as jhadu lagana. But sometimes the tumor particles are sticking to the walls. When they are sticking to the walls, it is important to remove this component. That is why in such cases, dry mopping should be coupled with wet mopping. This is called as jhadu plus pocha, also called as extended curettage. Most common chemical used for extended curettage, phenol. You use phenyl at home for wet mopping, so phenol. Best chemical, liquid nitrogen. What do you mean by best? Best means decreases the chances of reoccurrence. The tumor does not come back. Success rate is calculated when you remove the entire tumor and you decrease the chances of reoccurrence. When you are doing the other surgical procedures, you can remove the tumor right from the center, intracapsular excision. You can remove the tumor from the pseudocapsule, marginal excision. You can remove the tumor with a normal cuff of tissue all around, usually 3 centimeter in orthopedics, wide local excision. This happens to be the commonest surgical procedure done in case of orthopedic oncology. And finally, remove the entire bone of the segment, radical excision. The most commonly done procedure, wide local excision, 3 centimeter margin. Let's talk about the general principles. Benign tumors, operated. Cartilaginous tumors, operated. So cartilaginous tumor, whether it's benign or it's malignant, it will be operated. Whereas most common surgery overall is wide local excision with 3 centimeter margin. Cystic lesions, you do curettage, like uni means single, cameral means kamra or cavity, bone cyst, also called as solitary bone cyst, also called as simple bone cyst. Whereas when you apply a chemical along with it, extended curettage. Most common chemical, phenol. Best chemical, liquid nitrogen. Four conditions in which you do it: aneurysmal bone cyst, chondroblastoma, giant cell tumor, and chondroma. These are 4 conditions where you do extended curettage. Malignant tumors, you will give chemotherapy before the surgery, followed by surgery with 3 centimeter margin, followed by adjuvant chemotherapy. Adjuvant A after. So A for after, A for adjuvant. And then remember the golden classical teaching. A tumor that melts like snow with radiotherapy is called as Ewing's. Most radiosensitive tumor known to mankind. But there's something I want to tell you. Both Ewing's and osteosarcoma, they peak in the second decade. Both Ewing's and osteosarcoma, they present like osteomyelitis. Both Ewing's and osteosarcoma, most common bone involved is femur. The only difference, osteosarcoma will involve the metaphysis, Ewing sarcoma will involve the diaphysis. And the last thing, both tumors. Although Ewing's is the most radiosensitive bone tumor, but the last thing, both tumors are treated by neoadjuvant chemotherapy followed by surgery, followed by adjuvant chemotherapy. So both are treated by the same principle.